I just like being around people. I just like interacting with people and liked medicine, like science. So that's something I thought I would be interested in doing.
Well, I was initially studying in undergrad to be an engineer, and I did a couple of co-ops and internships in engineering and didn't really like it. And then also sort of tagged along with a couple of physicians that I knew from the community. One was an internist, one was a family practitioner, and I just thought that fit me better, just interaction with patients and sort of the problem solving and so forth. And then sort of the more I got interested and the more I looked into it, the more I thought it would be a good fit for me.
To become a physician, it's from my family. My mother is a nephrologist, actually. So I actually wanted to initially go into nephrology, but I really loved cardiology, so I decided to go after what I loved and did it, even though it took a lot more time to get to where I am.
I was in 5th grade. It was the first time I got straight A's. I came home and my parents said, "You're going to be a doctor?" And I said, "Sounds good. Is it fun?" They said, "Yeah, you'll have a good time." So since that time, I thought I was going to be a doctor. And in 7th grade, I started doing a mentorship with a physician in our area. And from then on, I decided I was going to be a physician. So I know exactly the day I chose to be a doctor. But since then, set a goal, and I'm doing what I've always wanted to do. So,
I've answered that question many times, and I'm never really quite sure where it came from. My mom, who is now retired, was a nurse, and she was quite remarkable in the sense that she had her 3 children and then went to nursing school, and she was a graduate of Elgin Community College, of all places. And I can remember I was maybe 4, 5 years old. I remember her studying, and I would sometimes sit on the bed with her and study, and I actually would memorize medical facts. I had absolutely no idea what they meant. That may have been the start of it. I went to college thinking I was going to be an engineer, but I think that was largely based on a strong performance in science and math in high school. But I quickly learned that I didn't really have an interest in that, and I at that point decided to look at healthcare once again. I took a job as a nursing assistant. That was one of my summer jobs in college, and that was sort of a done deal at that point.
I mean, it's long ago, and in a way, not long ago. In a way, my both doctors, my both parents are doctors. So, and my father is cardiologist. It happens. So when growing up, I was growing obviously in a different environment, growing up in Poland in different circumstances and so forth, and certain choices were limited in terms of careers too at that time. So in the end, I think sometime in the mid-high school or even earlier, probably, in a way, subconsciously, I always considered being a doctor. But when I made my mind that I want to be a doctor, I always was convinced that I would like to be a cardiologist. Actually, all my experience through education and postgraduate training and in Poland or United States always reconfirmed my desire to be a cardiologist. I really think it's one of the greatest jobs you can have. I always tell everybody, so it's sort of a joke between our group here and at Sherman, between our colleagues, that because I believe in it.
I think as long as I can remember, I've always wanted to be a nurse. And I'm really glad that I am a nurse as an advanced practice nurse, because I have a master's degree in nursing. I'm able to really be able to not diagnose necessarily, but really delve into the patient's problems at a deeper level. And it's very very rewarding to be able to help them. I think that they really get attached to the people that they feel have met their needs at a really critical time in their lives.
I've always loved the sciences, biology, exercise physiology, and as I was getting my exercise physiology degree, I knew I wanted to even, do do more because I love learning about the human body and I wanted to make a difference. And so I went on to nursing school. I also come from a family, my sister is a nurse. I have a brother-in-law who's a physician who were a big influence on my life as well.
My mom is a nurse, and ever since I was a little child, she kind of showed that pathway. It was either going to be a teacher or a nurse, and I went to nurse.
For all of my 17 years here at Sherman, I've been doing some type of cardiac care, whether it was working in the cardiac care unit, the step-down unit, and then I really enjoy taking care of heart patients, and that's what I'm most comfortable with. So when this job opened up, I thought, this is something in the heart field that I haven't done yet, which is cardiac stress testing. So I thought, okay, well, let me try that, and I've been doing this for 8 years now. And it really is a great job because you get to see the patients when they're feeling well, as opposed to, not feeling so great when they're an inpatient in the hospital. So it's a nice change.
What made me realize that I wanted to go into this field is like I said, just wanting to help people. I liked medicine always. I liked helping people, interacting with people, and I love science and just dealing with medicine.